Okay, so what we've done so far is we've done a full level 2 facial right up to the steam. We're not going to exfoliate, and we've left that out, and that's because any grit that's left on the face can be dragged across the face and can scratch a client, can mark their skin. As the ventouse goes across, it can drag the exfoliator across. So we don't exfoliate, but we do steam. At the beginning of this treatment, something that needs to be mentioned is that you would have already done your sensitivity test. So you wouldn't do that when you get to this stage before you start applying electricity. You would always do that at the very beginning. You need to know before you start whether your client has a problem with sensitivity. And you would do the thermal one, which is the hot and the cold test tubes, obviously not boiling water, but enough for the client to be able to tell you whether they can feel if it's cold water or warm water. Or you would do the tactile. The tactile is soft and sharp, so you would get an orange stick, you would tip one end with cotton wool, and you would very gently, with the sharper end, place it on your client's skin, and then turn it with the one that's got the cotton wool on, and they should be able to tell you whether one side was nice and soft and whether the other side they could feel as a little bit sharper. So you've done that, you know your client is okay. Now we're covering that now, even though we're doing vacuum suction, which isn't actually applying electricity into your client, it's using a vacuum suction to pull out impurities, blackheads that have already softened, whiteheads, all of those things, and to basically get rid of any oedema as well, any fluid retention, any puffiness. This treatment will do all of that for you. So even though you're not applying electricity, I wanted to cover the sensitivity test because I want to get you in the habit of doing that, because you need to do that with every single treatment you do. So the same rule applies with the amount of suction that goes into your ventouse. It's 20%. As you know, the whole ventouse is going to be 100%, therefore half of it would be 50%. A quarter of it would be 25%, so it's below the 25%, just below the 25% mark that you want in here. You must remember to adjust this as you go around the face. For instance, the neck will have a lot more tissue, and you can suck up and bruise them far more on the neck than you will, say, on the forehead. So you must adjust your dial accordingly to only have 20% in your ventouse. So you've tested the machine on yourself. We know that it's sucking and not spraying. And then we would make sure that in our ventouse, we're going to put that on the face, cover the hole, and whatever it sucks up, you don't want any more than 20% in that ventouse. So we don't need to have our machine on because we're using an actual model at the moment and not a person, but we need to go through the actual routine. So just to recap, the whole side of the face, down both sides, you will be going outwards towards the nearest lymph nodes. Everything is towards the nearest lymph nodes. When you get to the ridge of the nose, you're coming up, and when you get to the chin, you're coming down. Now, we all know that the nearest lymph nodes on the neck is behind the ears, just here. So these moves will be coming up and, out again, but up towards the ears. And on the chest, we've got the lymph node in the centre here, so they're going to be coming in. So without the machine on, because we don't actually need to do it, you do need to remember to not let the wire touch your client's skin. And you need to remember that you do not place the ventouse on your client's skin or lift it while your finger is covering the air hole, because if you do, it's going to bruise them. So, starting from the top, we're going to overlap every stroke. So we would stretch as we go. So we would come out above the brows towards the nearest lymph node, release and back, overlap, stretch, release and back. Now remember, you've already checked that there's only 20% in your ventouse. So just for the camera, let's show you the other side. You're going to stretch, keep the ventouse flat so that you've got suction, release before you lift, come back, overlap the ventouse, put it down, cover, release and back, overlap, and you're making sure that you're stretching the skin as you go. Now obviously this is sliding around a little bit, it wouldn't do that on a client. Release and back. So when you've covered the whole of the forehead, you can do the ones in the middle that were coming up. So you would stretch, get your 20%, come up, release, stretch, release, down, cover, stretch, release, release. Okay, we're going to do the face now, the cheeks now. You're not going to get too close to the eye. It's very, very delicate tissue, so stay below the eye socket, stay on the actual bone, the bonier area. You're going to put this down, check that you've got only 20% in your ventouse, adjust if you need to with the dial. Then when you've got your 20%, you're coming round, release and back, overlap, down, release and back, overlap, and you would make your way all the way down. Even when you get to the mouth, you're going in the same direction. You're heading towards these lymph nodes where any waste, anything that you're moving underneath the client's skin, any swelling, water retention is getting flushed towards the lymph nodes. And you're overlapping every single time. So no part of the face is going to get missed. Now when you've done this whole area, we can move on to the chin, and as we know with the chin, we're coming down. So we're still stretching, but we're coming down, release, down, release, down, release, and down. And we'd have done that on the other side of the face as well. So moving on to the neck, we know that we're coming outwards towards the nearest lymph node, which is behind the ear here. But for the sake of the camera, I'm going to show you on this side. So make sure that your wire isn't touching your client's skin, and make sure that your machine is adjusted so that you've only got 20% again in your ventouse. And you're coming up, stretching as you go. Never go over the lymph node, only go up to the lymph nodes. Never actually put the ventouse over them. We'd never put pressure over lymph nodes. We're overlapping again, and everything is coming up and out. And you're making sure that you release your finger from the hole. Now I've been lifting my finger so that you can see my thumb is now covering the hole, and I just move my thumb up and down over the hole as and when I need to release it or cover it. Make sure you stretch, make sure you overlap. Okay, so that now just leaves us with the décolletage area, and we're going to come in. It's the only area where you come in, and that's because the lymph nodes are here, near the clavicle. So you would literally stretch as you go, come in, release, back, cover, stretch, release, back, cover. And you would have already checked whether you've got the 20% again or whether it needs adjusting. Okay, so you've done that whole area. You wouldn't take the ventouse over any bony areas because you can actually scratch or graze them. So be careful maybe with the clavicle as you come across that, because you don't want to harm them. So we've gone around the face totally with that routine once, and you now need to do it again 5 to 8 times. So you'd come straight up to the top, readjust your machine to 20%, and you would do the whole procedure again, and then again, until you reach 5 or 8 times, depending on what treatment you are actually doing for your client, what you're charging, and the amount of time that you've allowed for that treatment. So that is the vacuum suction with the normal ventouse, the one that's going to cover the whole face. You would then swap to the flat-ended one. This one's got a little bit of bubble wrap in there, so just ignore the bubble wrap, it's where it's stored. And on this, I want you to imagine that the client's got the deep lines, forehead, maybe around the sides of the eye. So because of the shape of this ventouse, this allows you to go all the way in those lines, and what it will do is it will pull them out and plump up the area that has sunk. It's not a permanent solution, but regular treatments, their skin and their lines will look better and better all the time, because you're literally bringing back out what has sunken in. And the earlier the client has these treatments done, the better the results will be. So that's the first way that you would use the flat-ended ventouse. You can maybe do the eye area, but remember, 20%, no more. You don't want to bruise your client. So if they've got little lines coming down here, you may want to do from the nose round the cheek area. If that is a little bit sunken, then you can bring that area back out again. But where this one's really good, girls, is the side of the nose. Although this lady's nose isn't moving for me, when you work on each other, you will see that you can get right in the side of the nose, and it drags out all those blackheads, whiteheads, impurities that gets caught up at the side of your nose. So we would use it there. So that would basically be, to recap, the forehead, any crow's lines around the eyes, deep ridges from the nose round the cheek, and in the crevice of the nose where the round one may not fit so well. Now, when you've done those 2 procedures, you are going to now move on to doing the comedones. You are turning the round ventouse the other way, so that the smaller end is now on your tube. You can turn this up a little bit more if you need to, but not all the way. And you would literally identify where you've got whiteheads or blackheads, anything that needs extracting, and you would use this to do it. So you would place this over the client's blackhead, cover the hole, and very often you actually see the impurity come through into your ventouse. So if the blackheads have already gone into a situation where they're soft and that they can be extracted, this will do it. It will drag them out. If the blackheads are quite deep and they're not ready to come out, or they're stubborn, then obviously you might need to do a few of these treatments before you fully pull them out. But it will start to dislodge them and move them to the surface. Whiteheads, obviously, that are about to be, that are ready to be extracted, come straight out. So don't be surprised if you actually start to see all the impurities from their skin in your ventouse, where you've pulled them out with suction. So once you've done your blackheads, whiteheads, anything that you wanted to dislodge or completely pull out, this part of the treatment's done. Obviously there'll be impurities maybe on the face, so what you would now do is with your sponges you would remove any oil that's on the face and cleanse it. You would then do a nice massage, but literally only a 5-minute massage, mostly effleuraging to calm the area down that you've been working on. You would remove that product, that massage product, whether it's oil or whether it was a cream, depending on the client's skin type. You would remove that. You would do your mask, just like you would for a normal level 2 facial. You would remove your mask, tone and moisturise. So this is literally a full 1 hour facial with a 15 to 20 minute vacuum suction treatment right in the middle, after steaming, before the massage.